Good afternoon, everyone. Welcome back. Thank you for joining us. I'm Steve.
And I'm Scott.
And together we're Backyard Musing. We're glad that you're here.
Yep. And we are talking about this is kind of a concerning story. And we've been talking about a few of those lately. So this has to do with medical records and your well being. And this is kind of, like I said, kind of concerning. So let's get into it.
Yeah. New research suggests that patients with duplicate medical records face substantially higher risk during hospital stays, including greater chances of intensive care and death. Patients who have more than one medical record are far more likely to experience serious harm after being admitted to hospital, according to U.S. research published online February 3rd, 2026, in the journal BMJ Quality Safety. Would you like to know more?
The study found that these patients face a 5-fold higher risk of dying in a hospital and are 3 times more likely to need intensive care compared with patients who have a single unified record. The findings have led, and that doesn't make sense to me. The findings have led researchers to call for stronger safeguards around data accuracy and changes to health information management policies to improve patient safety. So what do we got here? We got just a bunch of people that are lazy about paying attention to records, right? Because you would think that more is better.
Yeah, but it might be a case in point, like a veteran who gets some care at the VA hospital, but their spouse has insurance through their employer, like Kaiser, and the VA takes a long time to be seen, right? So you go to Kaiser to get seen immediately, and then when you're getting your normal care from the VA, those records may not sync. So something might be diagnosed at the VA that's not communicated, and it's up to the veteran to tell the people at Kaiser, hey, the VA diagnosed this. And those records, they don't talk to each other, unfortunately.
Well, again, I go to McDonald's this afternoon and I buy a hamburger and French fries and a soda, and somebody out there in the cyber world knows it. So you would think that they would be able to figure out a way to link those records.
Yeah, medical, not secrecy, but HIPAA, safeguarding information in the medical world is a little bit more stringent.
I get that, but I mean, if it's one medical organization communicating with another one, that to me, I don't know if that would be HIPAA related. Maybe it would. I don't know.
They should automatically they should be connected and synced. All medical records should be, for the health of the patient.
Right. Because you see that even when you go to the doctor. So sometimes when you go to the doctor, and if you go often, or maybe you don't go often, maybe you only go for a physical every couple of years or whatever, but you would have to fill out a form. Same physician, fill out a form listing the same things that you've listed over and over again. And it is that because they're lazy at record keeping, they don't want to keep those records, or are they just looking for updates? Or can't you just have like an update section where, last week I've never had a heart attack, but last week I had a heart attack.
Think about this. You decide you don't like your dentist anymore, and you go to a new dentist. What do they do right away? They take x-rays, right?
Right.
Those x-rays should be shared, but I could see how the other dentists would be spiteful and not want to share x-ray records because you've left them for another dentist, which is kind of petty.
Yeah, but again, that's one of those things where they're your x-rays, right? Even though you took them, you paid for those x-rays, or your insurance paid for them, and you paid for that insurance through premiums or whatever. Those records should go with you. If I leave someplace, I want my x-rays. And that just came up in a thought process just right now, because I've left several dentists and never taken anything with me, or doctors. So
it used to be back in the day when you changed duty stations in the Army, you had to take your medical records with you to the new duty station and give them to that local Army hospital that's on base. You'd actually take your folder of all your medical records.
Well, doesn't that not make sense?
Yeah.
Right. You should, when you leave a physician, you should walk into the new physician and say, here's my bona fides right here. Here's all my stuff. And that way they can look at it and they'll say, oh, well, maybe we should check this out. Maybe we
This
should
is
check
a
that out.
serious problem, needs to be fixed, you know?
It does, definitely. So,
Okay, duplicate records arise when one patient is assigned multiple medical record numbers within an electronic health record system. The researchers, well, that's one way. The researchers estimate that this problem affects between 5 and 10% of patients. While duplicate records are known to disrupt continuity of care and create gaps in clinical information, the researchers note that their direct impact on patient outcomes has not been well understood.
yeah. To explore this issue, the research team examined key inpatient outcomes among adults up to age 89 who were admitted to one of 12 partner hospitals in a large U.S. health system operating across multiple regions. The study covered admissions between July 2022 and June 2023, so about a year, and tracked outcomes such as length of hospital stay, readmission within 30 days, emergency procedures, admissions to intensive care, and death during hospitalization. Okay.
All patients have been discharged from medical, surgical, or orthopedic care teams. During the study period, researchers reviewed 103,000 medical records and identified 73,000 patients who met the eligibility criteria. Within this group, 6,000, almost 6,100 patients were selected for analysis. Nearly 1,700, really close to 1,700 had duplicate medical records, while 4,388 had a single record.
The researchers deployed a statistical technique called propensity score matching, which balances out similar characteristics in two different groups of people. In this case, with and without duplicate medical records. Analysis of the results revealed that those with duplicate records had significantly higher odds of worse outcomes. That's just crazy.
Yeah, inpatient death occurred in 11% of those with duplicate records compared with 2.5% of those without. An average length of stay lasted 101 hours compared with 74 hours. Patients with duplicate charts more frequently required an emergency intervention, 6% versus 5%, and they were more likely to need intensive care, 46% versus 19%. The 30-day readmission rate was also higher, 12% versus 11%.
After adjusting for further potentially influential factors, such as destination and support needed at discharge, patients with duplicate records were 30% more likely to be readmitted to the hospital, and they were 3.5 times more likely to require intensive care, and almost 5 times more likely to die while in hospital than those without duplicate records, and their hospital stay was 32% longer. Just, I don't know, there's a lot of factors here. This is really, really scary.
This is an observational study, and as such, is unable to reach definitive conclusions without cause and effect, added to which the researchers acknowledge various limitations to their findings. These include that they weren't able to account for the number of diagnoses and healthcare encounters, and data from a single health system may limit the generalizability of the findings, they say.
Quote, despite these limitations, our study highlights a concerning association within our system and underscores the importance of for outside systems to investigate their own associations, determine causal pathways, and develop mechanisms to prevent duplicate chart creation and or conduct data integration expeditiously. Okay.
To explain the associations they found, the researchers suggest that duplication might prevent providers from accessing critical information such as allergies or medical history that could influence the type of treatment provided.
Another quote, an additional hypothesis relates to efficiency. The presence of duplicate charts may contribute to care delays or inaccurate orders as medical teams search for information that is not readily accessible, spend extra effort navigating between multiple charts, or inadvertently overlook key details. There again, I think that right there, that little paragraph that I just read or quote, that's just signs of being lazy, right? I think they're just complacent. That's
well, I mean, and not to be an apologist for the doctors. I mean, those doctors are slammed. I mean, they've got like piles of stuff they got to go through on their desk to get ready to see the next patient. So I think it might be swamped too, overwhelmed.
That could be too. Yeah, I know at some places, like you mentioned, a care facility, a rather large care facility earlier in the conversation. They are huge, and they've got, I know some doctors, or at least one doctor that works for them, and he is, overloaded.
Yeah. Okay, another quote here. These findings highlight the association between duplicate medical records and adverse patient outcomes, emphasizing the need for research to understand the impacts of duplicate charts, as well as targeted interventions to improve data integrity, enhance patient safety, and inform policy changes in health information management, they conclude.
Yeah,
I think we need a unified health system for records, I think we need that.
I do too. I think there should be one record. I mean, look at what they've done for cars. I think they call it Carfax, right? You can go on a website, and with a VIN number, you can find out anything that's been done to that car, accidents, maintenance done. They should have that same thing for humans. So
what we're seeing is medical data suppression. That's what I think.
Send me your money so we can get that going. All right.
All right, folks, leave comments if you like what we said. If you like the humor, leave the comments.
Yep. And I hope you enjoy your Monday, the rest of your Monday, and we'll see you tomorrow.
See ya.
Take care, everyone. Thanks.